President Trump is cutting Medicaid for millions of seniors, including those in nursing homes, in order to pay for tax cuts. Millions are going to feel the pain because Medicaid coverage, which pays for 62% of nursing home care, is seriously in danger of being gutted in ways that we've never seen before. I have done all the research, I have the latest news to update you on this critical issue that is going to impact millions of seniors around the country. But first, let's start with some exciting news. There is a stimulus check. The president is on board. The DOGE 5,000 stimulus check is real. I'm going to bring you the latest details on what that means and whether seniors and people on disability are eligible for this stimulus check. So let's get started. So if you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that is going to affect your Social Security, Medicare, Medicaid, food stamps, and more. But before we get started, I want to know where you're watching this broadcast from. Let us know your city and state. And if you're watching from outside of the country, I also want to know where you're watching this broadcast from. So hit me in the comments with your city and state right now. But we have a lot to cover. Let's start with the biggest news, breaking news. President Trump is on board to send $5,000 in stimulus check from the DOGE program to Americans. This is Fox News confirming this breaking news. The president is considering this, and it's all over the news. This is another false broadcast talking about Trump administration considering stimulus checks for taxpayers. And then we have CNN. 20% of the DOGE proceeds has been earmarked for stimulus. And this is Forbes. So everywhere you look, this is in the news. And I wanted to bring you the details because what seniors care about, what people on disability care about is, are they going to be part of this stimulus check? Because previously we've had this experience before where there's been a big announcement of stimulus, and then we find out that there are certain groups of people who are not eligible. So let me bring you up to date on this. So this all started when CEO James Fishbank of an investment firm proposed a DOGE dividend on social media. This got the attention of Elon Musk. He said he was going to check with the president, and then Trump came on camera and said he was in favor of sending a 5,000 DOGE dividend, which is a form of a stimulus to Americans. So here's how it will work. The plan would take $400 billion, which is 20% of the expected savings from the $2 trillion in DOGE savings, and return it to the American people. This will occur in July 2026 after the DOGE program has completed its cost-cutting mission. And both Trump and Musk have expressed interest in making this happen. So I have no doubt that this is going to be on the table. While DOGE claims $55 billion in savings so far, they've only been able to verify $8.6 billion, but they have up until July 2026 to find $2 trillion in savings from waste, fraud, and abuse. And so they are on track to accomplish that. Now, the implementation schedule means that Congress will have to vote on this. And now it is before the Republicans and Democrats to figure out how they're going to make this happen. But here's the details. Only households that are net taxpayers of federal tax will qualify, which means that 40% of American households who do not make enough money to pay federal taxes may not qualify for this. So I want to emphasize this because sometimes whenever stimulus payments are announced, seniors and people on disability or low income or people on fixed income are the last to find out whether they're eligible or not. So roughly 130 million households exist now. Only 79 million will be eligible for this. And it is aimed to encourage people to pay into the tax base. And this is supposed to be for people who are paying taxes. Now, there is one disturbing part of this program that I want to bring to your attention, and it is this National Snitch Network, which is supposed to encourage citizens to snitch on each other and report waste, abuse, and fraud. That is already something that you can do right now, but now they want to nationalize it where they will incentivize people to report fraud, abuse, and waste in the federal government. In return, they're going to accumulate all the money that is saved from those reports and then return it as a DOGE dividend, as a permanent thing that will happen year over year. So basically, what is going to happen is that people on government assistance, food stamps, Medicaid, Medicare, not Medicare, Medicaid, food stamps, and other economic security programs are going to then face increased scrutiny, because then people will be able to report them if they think that they are committing fraud or abuse or waste. Now, the proposal will be favoring higher income households, and obviously that's not a surprise. The reporting incentive structure will lead to increased stigma and barriers for legitimate assistance program users. While there's also concern that this could cause inflation, the president and Elon Musk are very determined to make this happen, because I think it makes their program credible. If DOGE can return money to the American people and send $5,000 checks because they've saved money out of fraud, waste, and abuse from the system, then it makes the system attractive. It gives people buy-in into the DOGE program, because right now there's a lot of anxiety by the way DOGE is just running rampant through the government, shutting things down, closing contracts, shutting down departments. And so now there's a lot of anxiety around it. But if this DOGE stimulus can be brought in where they can actually send money back to the American people and say, hey, look, we went in there, we found all this waste, fraud, and abuse in the system, and now we're returning $5,000 back to you as a stimulus, which is only 20% of the amount that is earmarked for DOGE in terms of the total savings, then you can get more people to buy into the idea that, cleaning up the government, even if it's a radical and very aggressive way of doing things, is worth it. So here are the details. The proposals have to go through Congress. If approved, it will happen in July 2026. And obviously the election is coming up in 2026. So that may also be a factor here. So I will keep you posted on that. Now, this is different from the COVID era stimulus, where, we were taking money from, the federal purse and paying it back to Americans. Here, the money is being taken out of money that's recovered from fraud, waste, and abuse. So it's a very interesting concept, and Elon Musk is trying to make it permanent so that people will be incentivized to pretty much snitch on each other and report abuse, fraud, and waste. And then each year, that money can be accumulated into a pot and then returned to the American people. So I want to hear from you. Do you think that this is a good idea? Or a lot of you have gone into the comments and you think that the money should not be returned as stimulus, but instead you're suggesting that it should be put in the Social Security Trust Fund. It should be put in the Medicare Trust Fund, because those two are in danger of running out of money in 2033, at which point there will be 21% cuts in Social Security benefits. So a lot of you have been encouraging and commenting that the DOGE savings, rather than issuing a stimulus checks to people, it should be put back in the Social Security Trust Fund. It should be put back in the Medicare Trust Fund. If you agree with that, I want to hear from you in the comments. Or if you have any other idea that you think they should be using the DOGE savings for, instead of issuing a stimulus check of $5,000 to everybody, I want to hear your comments in the comment section below, because this discussion is ongoing, and I'm sure they're still listening to the public and how people feel about this. And so let me know what you think in the comments. Now, the biggest news today is Medicaid. The House of Representatives last night passed a huge budget bill that is going to gut Medicaid like you've never seen it before. This is serious and is going to affect seniors in ways that many did not imagine or expected. So let's get into it. But before we do that, let me digress and talk about Medicare for a second. There is a small window that is open right now for you to get into a better Medicare plan, and it ends at March 31st. 90% of seniors are in the wrong Medicare plan, and that is why a lot of people find out when it's too late that their program has been dropped, that they are not covered for something that they thought they were covered for. And so we've partnered with Chapter Medicare, and these guys do not work for commission. Their only mission is to help you get into the right Medicaid program that is good for your budget and saves you money. And here is the best part. They have access to all 24,000 Medicare plans that is in the country. They are the only company with access to that. So the call is free. The service is free. Give them a call at 205-2147, or click on the link in the description and fill out a quick form, and they'll be able to get you into the right Medicare program. Don't wait. Time is of the essence. Now let's talk about this big cut to Medicaid. So I'm gonna slow down here and really talk about this, because this breaks my heart in a way, because what is happening, I don't think a lot of people understand the big changes that are about to happen to Medicaid. So Trump said in an interview with Elon Musk that he would not touch Medicaid. And then hours later, he endorsed a GOP plan that would slash the program. Well, that has become a reality, because last night, the House of Representatives passed a budget bill that is going to gut Medicaid and put seniors at risk, especially those in nursing homes that are going to lose critical coverage, because a lot of people don't know 62% of all nursing home care is paid for by Medicaid, not Medicare. Medicare does not pay for nursing home care. It does not pay for long-term care. So if you're a senior and you don't have money to pay for long-term care or nursing home care, Medicaid is what pays for it. People don't know that. 62%. And 1 in 2 births in this country, when people go to the hospital and give birth to a baby, 1 in 2 of them are paid for by Medicaid. And so this is an important health program for low-income adults and seniors and children. And now it's on the chopping block, and it has been done. The House passed a bill to gut Medicaid by $880 billion and food stamps by $230 billion. And this is all to finance tax cuts that is primarily, overwhelmingly, going to benefit the rich. So Trump has endorsed this cut, even though he said on camera with Elon Musk in an interview that he was not going to touch Medicaid. He had already said he was not going to touch Medicare and Social Security. We already know that. But he was on camera saying he would not touch Medicaid, because Medicaid pays for health care for 82 million Americans. And it's such a critical program for seniors. And he said he was not going to touch it. And then days later, that's exactly what they did. They have gutted Medicaid. Seniors are going to lose care in nursing homes. Seniors on long-term care are going to lose care. People who depend on Medicaid for home health aids are going to lose those home health aids, because they are cutting $80 billion out of the program. And that is a huge chunk of money. So the House Representatives unveiled a budget to find $882 billion in savings over the next decade. This represents one of the largest reductions in Medicaid program in history, targeting a program currently serving 80 million Americans. The cuts are being proposed to help finance Trump's tax cut, estimated to cost between $5 to $11 trillion over 10 years. The administration claims it will only target waste and abuse, but analysis show that the cuts will require significant cuts to Medicaid. And they were targeting a vote for yesterday, and that happened. And so here's where we are now. Medicaid currently provides health insurance for 80 million Americans, and it costs $870 billion a year. That is the third largest item on the federal budget. 9 states, including Virginia, have laws that will automatically end Medicaid expansion. So here is the consequence of what the House has done. Because of the law that the House of Representatives approved yesterday, there are 9 states with trigger laws where if the federal government reduces its investment in Medicaid, the trigger law means that the state is also going to reduce its investment. So in Virginia, for example, this means that over 630,000 Virginians alone will lose coverage immediately if the federal government contribution decreases. So not only are they guarding things at the federal level, but it's also going to trigger things at the state level that is going to unwind a lot of people's programs very quickly. So if you live in a state where Medicaid was expanded to cover adults without dependents, well, you are in danger of losing your benefits too because of some of these trigger laws. States would need to either dramatically increase their own spending or reduce services if federal funds is cut. Many states will likely be forced to choose between raising taxes or cutting benefits. And here's another big impact of what they did yesterday in the House. Hospitals and Healthcare providers, particularly in rural areas, depend heavily on Medicaid payments for survival. That is a fact. A lot of rural hospitals cannot survive without Medicaid. Any significant cuts will force facility closures and reduce access to care in vulnerable communities. In addition, states will face increased costs and complexity in implementing new requirements, such as work requirements or more frequent eligibility verification. It means that you are going to constantly have to prove that you need Medicaid in order to stay on the program. Here are some of the things they did yesterday. Republicans are considering a nationwide work requirement that will save $109 billion, but will cause approximately 1.5 people to lose coverage. On top of that, a proposal to limit federal funding based on population will save $900 billion over 10 years, which means that rather than focusing on providing Medicaid coverage to people who need it, they're going to give each state a pot of money according to population, and then the states have to figure it out. So if a state runs out of money, so if your state has a disproportionate amount of seniors and has a disproportionate amount of people who need care and has a disproportionate amount of low-income people, then they're going to need more money. But the existing system accommodates for that. But what they're trying to do now is send a state money based on their population, regardless of how many people in that state need care. And if the state runs out of money, then that's it. Then everybody's out of luck. The third proposal is that they want to include reducing the federal government's contribution rate to Medicaid, because Medicaid is a state and federal government joint program. The federal government pays the bulk of the money, and then the states contribute a little bit. Well, they want to reduce how much the federal government contributes, and that will save over $530 billion over 10 years. So as you can see, every single change they are making is draconian and also significant, and is continue to limit or drop people from the Medicaid program. And then they plan to limit states' ability to maximize federal matching funds through supplemental payment programs, and that's also supposed to save $175 billion. So what does this mean? Well, Medicaid pays for essential services, including nursing, home care, health, home health aides. So if you have a senior citizen in your household and a family member or somebody's coming in to pay for them to live and age in place, and Medicaid is paying for that because Medicaid pays for 62% of that kind of programs, that's going to be gone. Personal care services, medical equipment that many seniors rely on daily. For many middle-class families, Medicaid becomes a crucial program when their savings are depleted by long-term care costs that Medicare does not cover. And then here's another critical group that is also going to lose coverage. Over 12 million Americans are dual eligible. It means that they're eligible for Medicaid and Medicare, meaning they qualify for both programs, and this is where they're going to feel the pain. If you are dual eligible and you're eligible for Medicare and Medicaid, the Medicaid portion pays for your Medicare premiums, your deductibles, and services that Medicare does not cover. So if you're one of those 12 million people that have dual coverage, now your coverage is in danger. Another area that's going to be devastated is long-term care coverage. Medicaid is the primary payer of long-term care in America, covering about 62% of all nursing home residents and being the only program that covers extended nursing home stays. Without Medicaid, many middle-class seniors will be unable to afford nursing home care, which costs about $90,000 a year. So guys, this is serious. Go online and Google the bill that the House passed yesterday. It's going to dramatically gut Medicaid, and this is the consequence. Home and community services. Medicaid provides crucial support that allows seniors to remain in their homes through home health care services, personal care assistance, and medical equipment. These services help seniors avoid or delay expensive nursing home care while maintaining independence in their home. Well, that program is in danger also. Family caregiver support. Medicaid helps support family caregivers through programs that can pay family members to provide care through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs. So the question you're probably thinking is, would they really gut Medicaid to hurt seniors? Would they really gut Medicaid to help people on disabilities? Would they really gut Medicaid to help, children? That is exactly what they've done. And I know when these things come up, a lot of people are like, oh, they would never do that. They would never do that. Well, that's exactly what they've done. They have gutted Medicaid in ways that millions are going to feel significant pain in order to give tax cut to the rich. So for seniors who have exhausted their savings paying for healthcare or who never had significant savings, Medicaid serves as a crucial safety net, ensuring access to necessary medical care. And I know a lot of seniors never realize that Medicaid actually forms a very, very significant part of their healthcare, even if they don't use it now, because 62% of all nursing home residents are being paid for by Medicaid. So the proposed $80 billion cut is going to affect states. They will be forced to reduce services, tighten eligibility, or cut provider payments if federal funding is reduced. And as I mentioned, 9 states have trigger laws that if the state realizes that the federal government is going to reduce their contribution, the state automatically reduces their contribution and drops people from the Medicare expansion program. And then the cuts will also force many nursing homes and home health agencies to close or reduce services as Medicaid is their primary source of funding. Rural areas will particularly be hit hard, potentially leaving seniors in areas without access to necessary care. And here's the family impact. Reduced Medicaid funding will shift more costs to seniors and their families, potentially forcing difficult choices between medical care and other necessities. Many middle-class families will face financial crisis when confronting long-term care needs that Medicaid currently covers. The disabled. More than half of all Medicaid spending goes to elderly and disabled beneficiaries who require long-term care services. These populations will likely bear the brunt of any cuts due to the higher healthcare costs that they need. Children. Medicaid covers 1 in 3 children in America. So 1 in 3 children, any 3 children you pick in this country, 1 in 3 are on Medicaid. And it pays for half of all births in this country. Any cuts would disproportionately affect children's access to healthcare. Working families. Many Medicaid recipients are employed but work in jobs that don't offer health care or pay enough to afford private coverage. So if they cut Medicaid, even people who are working and cannot afford health care or don't have jobs that provide health care are also going to be impacted. And then rural hospitals and clinics are particularly dependent on Medicaid funding to stay operational. Cuts will accelerate rural hospital closures and force or reduce healthcare access in these areas. So because of this, even some in the GOP are uncomfortable with this. You probably know Steve Bannon, and he's been very vocal and warning the Republicans that if they do this, they're going to lose their base, because he understands that a lot of Trump supporters and a lot of people in the country, regardless of their political affiliation, depend heavily on Medicaid. 82 million people. And so gutting Medicaid to finance tax cuts for the rich is really going to look bad politically and lose support. And so Steve Bannon has been championing a rebellion against the Medicaid cuts, and they ignored all of that. And last night, they passed the bill in the House to do exactly that, gut Medicaid in ways that we've never seen before. And the impact spreads beyond that. Local businesses, many small businesses rely on Medicaid to provide health insurance to their workers. They are going to feel the pinch. Insurance market is going to be disrupted because major insurers like Centene and Molina, which specialize in Medicaid managed care, would face significant business disruptions. This could lead to market instability and reduced competition. And states with reduced funding will either have to raise taxes or cut services. So I want to hear from you. What do you think about these draconian Medicaid cuts that are coming up. President Trump said he wasn't going to touch Medicaid a few days ago, and now that's exactly what they've done. He's supported a bill that has gutted Medicaid like you would never believe. Let me hear from you in the comments. Are you going to be impacted by this? Do you know somebody that's going to be affected by this? Are you worried about your own coverage? Let's have a discussion in the comments and let me know how these Medicaid cuts and reduction is going to impact your community. If you're a senior or you know somebody that is on a nursing home facility on Medicaid or in a long-term care facility on Medicaid, well, a lot of people are on memory care facilities that they cannot afford. And now this is coming, and you would think that a lot of people thought this was not going to happen, that they would never gut Medicaid and throw millions of people off the program. That's exactly what they've done. Let me hear from you in the comment section. I cannot wait to chat with you. So tomorrow, I'm going to do more research and bring you details about this in my live tomorrow. So stay tuned. And until then, let me know where you're watching this from. And we'll see you tomorrow on the live. Thank you for hanging with me on this Wednesday night.